I want to wish you all a good afternoon. I'm Bud Basic. I'm the Provost and Executive Vice President here at Case Western Reserve University. It's my great privilege to welcome you today to the 7th year of this outstanding program, the Ford Distinguished Lecture Series. We've hosted a wide variety of folks over the years, including Jeff Hawkins, the inventor of the Palm Pilot, Bob Langer, a leading scholar in tissue engineering, and Dean Kamen, developer of the Segway. Every guest that's brought to campus through this program does more than deliver a single talk. I think as many of you have experienced today, each also spends a day with students and faculty in the Department of Biomedical Engineering. Our community in that way has the opportunity to learn firsthand from the pioneers and the leaders in the industry and innovation in science and engineering. At the same time, these pioneers see our faculty and begin to understand why biomedical engineering is among the highest regarded programs here at Case Western Reserve University, and certainly an outstanding program recognized nationally and globally. Their ideas and inspiration came to Case Western Reserve because of the vision and passion of two remarkable people, one who's with us, Alan and Constance Ford. Alan. Alan is here today, and of course he's at every one of these events. And those of you who are active in the university community know he's active in many different events, from the biomedical engineering events to the origins events. He's just extremely active, and we very much appreciate him here on campus. Alan's belief in the mission and the potential of our Department of Biomedical Engineering has kept him involved, again, as one of our great thought leaders, supporters, and at times biggest fans. He recognizes the immense talent of our faculty, many of whom are here today, and their unparalleled dedication to making a positive difference here on campus and around the world. Alan joined our Board of Trustees in 1976 and chaired the board from 1987 until 1992. He's a recipient of the University Medal, which is the single highest honor that the university bestows. And he continues, as I mentioned, to be very active today across the campus and as an emeriti trustee. Again, Alan, for all you do, thank you on behalf of the university. And now it's my great pleasure to introduce the new interim chair of Biomedical Engineering Department, Professor Bob Kirsch.
Well, thanks, Bud, and thanks to everyone for coming out today. As Bud said, I'm the new interim chair of BME, and one of the perks of this job is having the opportunity to introduce our fantastic speakers for the Ford Lecture Series. And I'll do that in just a second. But first, I'll take advantage of the other perk, which is to publicly thank Alan Ford for all the advice and support that he's given our department for now several generations of leaders that I know. And I really look forward to working with you, Alan, and I appreciate your support. I'd also like to thank Stathis Karathanassis. Stathis, where are you? So Stathis was the BME organizer, the faculty organizer for this event, and Ann Borchert and Lauren Biddlecombe for doing a lot of the legwork to put this together and make it a success. So the main event today is I get to introduce Nicholas Valeriani from Johnson & Johnson as today's Ford lecturer. Johnson & Johnson is obviously a big industry leader in the many products that are important for the clinical market. And Nick has played roles across the spectrum of activities that J&J has since 1978, I see here. So he's had positions in engineering, in operations, in sales management, and project management. He's held an amazing number of leadership positions at J&J and in different divisions, including being vice president of human resources, a member of their executive committee, and a leader of several of their medical device companies, including Ethicon Endosurgery near my hometown in Cincinnati. Nick is currently the company group chairman for the Ortho Clinical Diagnostics franchise at J&J, and he thus leads business strategy for a number of their diagnostic businesses. So Nick's lecture today is highly relevant to our department and to the broader biomedical community in Cleveland. Our faculty work every day to make discoveries that we hope will lead to significant improvements in healthcare. And through our Case Coulter Translational Research Partnership, faculty in BME and in the School of Medicine are working together to try to turn these discoveries into new products that companies like J&J can then develop and distribute broadly through the clinical community. Also, BME educates a lot of faculty that can build exciting careers in companies like J&J, and we had a nice conversation about that earlier. So our departmental tagline is engineering better health, and this is an objective that we clearly share with J&J and with Nick, who's an engineer and he has a sincere interest in preventing chronic disease and managing wellness. So we all look forward to hearing your talk today, Nick, your perspective as you talk about be, feel, live, a new perspective on our role in human health. So please help me in welcoming our speaker, Nicholas Valeriani.
Well, good afternoon, and thank you, Bob, for that nice introduction, and thanks to Bud and the entire Case Western team for being such gracious hosts over the past day and a half. You certainly have a great university, talented individuals, and I've learned a lot from all of you during my visit. Now, I hope I can reciprocate with my remarks today. As Bob mentioned, the title of the talk is Be, Feel, Live, a new perspective on our role in human health. And my hope is that these three words will inspire you today. They are simple thoughts. Now, in hearing the previous lecturers, I'm confident that you've probably heard more technical and more sophisticated presentations. But what I'm here to talk to you about today, while pretty straightforward, is hard to achieve. So why am I here today? I'm here because I want to make a difference. There's a change that I want to see in healthcare, what we can become versus sustaining who we are. If I leave here today just touching one person in this audience, I will have achieved the goal I set for myself. As I mentioned, the topic at hand is simple, but it is extremely hard to achieve. And that's because the path we're on is wrong. As a society and industry, we are focused too much on sickness and disease, and honestly, we don't value our health until it's threatened. And then when it is, we expect every treatment and every possible solution available to minimize or eliminate the risk we've encountered and essentially get us back to the health we had. But you know, in our country, we're spending way too much on health care. As you can see here from the slide, we spent nearly 18% of our GDP in 2009 on health care, nearly twice what's spent in other countries around the world. And in 2010 alone, we spent $2.6 trillion on health care. And if you think about that, according to the CDC, we spend about 75 cents of every dollar on treating chronic diseases such as obesity, diabetes, and cardiovascular disease. And it still isn't enough. 7 out of 10 deaths in our country are from chronic diseases and conditions. Our healthcare system is virtually incapacitated by the choices people make about their own lifestyles. So let me ask you, what else could we do with $2 trillion? Think about the possibilities. Could we keep people well so they don't become economic burdens to an already strained system? And we can achieve even more if we change the path we're on. Just imagine how many more children could we educate? How many more jobs could we create? How many more diseases could we prevent? Now, each of you, I believe, have a role in changing the path we are on and our possibilities for the future. Now, you might be sitting out there thinking, well, it's sort of a convenient thought to believe that this problem is someone else's to solve. The government, healthcare companies like Johnson & Johnson. But I'm telling you today, it's ours. The solution isn't out there. It's in here, in this room today. So what exactly is our role? I'm going to share with you today my role as the leader of the diagnostic businesses for Johnson & Johnson and what I'm trying to do with diagnostic technology to improve healthcare. and then I'll share with you my thoughts regarding what I believe your role is. You know, diagnostics in the United States make up less than 5% of hospital costs and less than 2% of all Medicare costs. However, the findings influence, approximately 60 to 70% of all healthcare decision-making. Now, as mentioned, I have been with Johnson & Johnson for over 33 years, with the last 3 years being dedicated and focused in our diagnostic business. I've been in a lot of different roles in a lot of businesses, and over the course of my career, I have never been more passionate about something that can be a key to driving change in healthcare than the future value of diagnostics. I truly believe that the future value of healthcare lies in the diagnostic technology and industry. But to get that value, we must change the way diagnostics work. Currently, the majority of diagnostics are offered in hospitals or in large centralized testing centers. They can be hard to access. The results at times are very hard and difficult to understand. The tests are run on large, complicated, and big machines. And my belief is that we need to move from machines to devices that put diagnostics in the hands of consumers. Tests that today are difficult to access and time-consuming need to get cheaper, faster, and more accurate. If you're familiar with the work of Clay Christensen at the Harvard Business School, and most specifically in his most recent book, The Innovator's Prescription, his belief is that the most significant change we can make in the healthcare system here in this country is to decentralize or democratize diagnostic technology. Essentially, push this capability out to the masses and make it more convenient and easier for consumers to access. The site of care of diagnostics need to change. For example, today you may only get your test results along with your annual physical with your doctor. Now, this is the traditional model, visiting an office and waiting weeks for results. My belief is that we need to move from this model to making diagnostics available where you live, work, and play. We need to get information to people through less expensive testing methods that can be used almost anywhere and give real-time results for consumers. And it shouldn't be once a year. Imagine if you could have access to your own health information on a monthly or even a daily basis. We need to move to this model of annual testing to diagnostics that enable you to take control of your own health with information that's available on a daily basis or, for that matter, whenever you need it. In fact, in the future, the annual physical may become extinct. It may not exist anymore. Each year, more medical students opt to become specialists versus primary care docs. So we need to move from a place of just having the information or data to having a conversation about that information. We need to take diagnostic information that can be made available to people on a daily basis and pair that with feedback and conversations so that that enables consumers to have control of their own health. Now, if you stop and think about it for a moment, the practice of medicine today is set up to tell us what is wrong. We need to change that conversation and give people the tools to enable them and to tell them how to stay healthy. If we can change diagnostics, we can change people. And that's what I'm focused on as I lead the diagnostic businesses for Johnson & Johnson. What if we could use diagnostics to engage people in guarding their own wellness? So think for a moment, what would you do today if information from a diagnostic test indicated to you that you were developing or on your way to developing diabetes? Would you change your diet? Would you exercise more? Diagnostics, I believe, can change the conversation from fighting disease to preventing disease, from avoiding sickness to embracing wellness and making better choices. Because simply put, better choices we make every day equal better outcomes. Now, I'm confident that we'll develop the diagnostic tools and technologies that will get us on a path to health. But the question is, what will it take to activate individuals? Now, I've learned a lot over the course of my career at Johnson & Johnson about business, but I've also learned a lot more about people. And the 7 things that I'm going to share with you now, I believe, are what will make people more engaged, active consumers, knowledgeable consumers of healthcare. Number 1, everyone has a purpose. And I think this is an important idea for all of us to consider. What is your purpose and your mission in life? You know, some of this, I think, comes from, our upbringing. And for me, I was raised in a blue-collar family in central New Jersey. My dad was a carpenter, and I learned simple values about life from him. His priorities were really clear, and they really were then transferred onto me. And in his life, family comes first, and there's no substitute for hard work, and every person in the world is a special individual with an important contribution to make. Then when I think about my life today, my dad was the inspiration for the purpose with which I live my life, and I want to share that with you at this moment. Simply stated, what I try to do is to enable others to achieve their life's ambitions. What I try to create for people is an anything is possible mindset. As a leader, I truly enjoy connecting with people on a personal and individual basis in a meaningful way to get them to believe in themselves and accomplish extraordinary things. There's nothing more important to me in my world as a leader, not just in Johnson & Johnson, but in the world. Number 2, being healthy matters. If you truly get clear about your purpose and mission in life, the only way you can achieve that purpose is if you are healthy. And what I want you to think about now is a new definition of what being healthy means. It's more than just physical. It's mental, emotional, and spiritual. It's the 4 of these in totality that really make you a healthy person, put you in a state of health and well-being. In fact, wellness is the integration of conditions that affect the body, the mind, and the spirit. And over my life, I've had the opportunity to engage in conversations and actually experience a learning for me with regards to health and well-being. And it occurred actually on a visit I made to a place called the Human Performance Institute, a company that is located in Orlando, Florida. It's based on the works and the research of Dr. Jim Lair and Jack Roppel. And it had its genesis actually in coaching elite athletes. And these 2 individuals took that work and translated it into a program for business executives. The program's called the Corporate Athlete. And the essence of this program is really to enable people to get connected with their purpose and mission. And if you're true to that, you then are committed to a life that is one that embraces health and wellness. And for me, in the past, I used to always think about the major indicator of my health, at least what I thought was really my weight. So I managed my weight, and as probably many of us in the room, in all different kinds of ways, crazy sort of ways, Atkins diets and things like that. And what I came to understand was that wellness is more than just your weight. And certainly physical is an important part of it, but that includes diet and exercise. And as well, though, it embraces this idea of emotional, mental, and spiritual health. And if you think about this, what it enables one to do is to really enhance your energy, to be more engaged in every interaction that you have, and keep you committed and focused on realizing your purpose and mission in life. And, I think there is a real business case with regards to health. As a business leader, healthy employees potentially are a competitive advantage for us. So while we sincerely believe and are concerned about our employees' health and wellness, my belief is that a healthy employee is a more engaged employee, is a more productive employee, and if the 4,000 employees of OCD were quote-unquote on fire with regards to their engagement, I believe we can be a more competitive company in the world. We believe this so strongly at Johnson & Johnson, we actually launched a business several years ago in employee health and wellness, and the Human Performance Institute was acquired and is now part of the Johnson & Johnson family of companies. But when you think about this, it's not just about the individual. It's not just about me. Being healthy, being engaged affects the communities around you. And first and foremost for me, it starts with my family. Who am I for my wife Nancy and my kids Lisa and Nick? Or for my brothers and my mom? It speaks to who I am for my colleagues at OCD and Johnson & Johnson. Am I giving my full and best effort on every interaction and every engagement I have with our employees around the world? Does it enable me to better serve the community where I live and work? Certainly an important value and commitment that we have as associates of J&J. And ultimately, beyond the community, to the world. It begins to cause me to think about what am I here to do and how can I give back to the world that I live in. Number 3, healthy is defined by the individual. Now, it's never too late to define what healthy means for you. If you take a look at this healthcare pathway, no matter where you are on this continuum, you can gain control of your own personal health and wellness. And when you do, you put yourself back on the right path. And as a matter of fact, through our lifetime, we'll probably find ourselves, at any stage of this healthcare continuum. And it's our ability to recognize that, gain control of the situation, and put us back on a path to health and wellness. The great thing about diagnostics is we can make this happen with the right technology providing the right information. We can make wellness just as important, and hopefully more important, as illness in the healthcare conversation. Number 4, it must be easy to participate. Another thing I've learned along the way is that the path to wellness must be simple and have a connection to what you are doing every single day in your life. And that means it must be personal. And as a leader, what I've learned is it's important, that you represent the caring and sincere concern you have for your employees and your associates, not just for what they do for you professionally at work every day, but for who they are in their personal life, a genuine, sincere caring. So let me share an example with you of how this has happened for us at OCD, Ortho Clinical Diagnostics. When I joined the company 3 years ago, one of the things I believe as a leader is that it's important to connect emotionally with your employees. And I believe that a vision statement for a company is an important leadership responsibility. Can you create an emotional call to action that connects with your employees' hearts and souls? And honestly, the vision that we had several years ago didn't do it for me, and I wasn't quite sure it did it for our employees. And what I wanted to do is to ensure that our employees saw the human impact of the work that we do every day. We sell billions and billions of tests, but at the end of it, every one of those tests is a person, is an individual whose doctor or caregiver was going to use that information to provide best clinical care. The other interesting thing about our company is that we have very long-tenured employees that have spent 10, 15, 20, 30 years with our company. And as I traveled around the world and asked our associates, what has caused you to stay with Ortho Clinical Diagnostics for so long? What motivates you to come to work every day? They didn't talk in terms of how big our machines were or how powerful our technology is. They talked about the impact they had on people's lives. They talked about the chance of potentially making the world a better place. And so we created a vision that simply states that we're in the business of enabling people to be healthier, feel better, and live longer. And what we did with this, we connected the work to the patient, but we also began to create a conversation for our employees to understand this for themselves. That in fact their management was concerned about them as individuals and what were they doing in their own life to ensure that they were going to be healthier, feel better, and live longer. I realized along the way, as we were creating this vision for our company and for our employees, that we needed to remove obstacles. So we implemented some pretty basic ideas to make this possible. And here again, it doesn't have to be overly sophisticated. It's the simple things that have huge impact. So for instance, in our company, we created what we call Wellness Wednesdays. And so what does this enable? Well, this allows our associates, one, to wear jeans to work, which is an interesting concept for Johnson & Johnson, but as well to wear sneakers. And just these simple things have gotten our employees to do things, take walks at breaks, take walks at lunchtime, be more active, use the stairs instead of the elevators. And they got them just to be more engaged with this idea about being well. We also, through our health and wellness organization, created seminars during the course of Wellness Wednesdays. And we educated and taught our employees about nutrition and meditation and managing stress. And so it's been really embraced, and it's a very energizing day for all associates. As a matter of fact, one of our admin associates on our floor is just an amazing individual and the impact it's had on her life. First and foremost, she's lost 42 pounds over the last year. She's changed her diet. She's eating, she's eating healthier. She feels like she has more energy. She's a different person, in her words, and it's very, very, very satisfying for us as a leadership team to see that change. And the important thing about this is it really does happen one person at a time. In businesses, we spend a lot of time focused on establishing business goals and objectives for the year. And what I've done over the last several years in my annual letter to our employees is asking them to spend time on their business goals and objectives. I've also encouraged them to spend as much time and energy establishing a personal health and wellness goal for the coming year. And, in that conversation, I've suggested to them it's theirs. They don't have to share it with their manager. Their annual review won't be based on how well they did against their personal health and wellness goal. But I want them to really spend the time thinking about it. And actually, one of my direct reports incorporated her health and wellness goal into her annual objectives that she submitted to me. And as part of our annual and quarterly reviews and conversations, we review her progress. And as a matter of fact, she as well has lost a significant amount of weight over the past year, and she's exercising on a regular basis. And so this idea about leadership and management showing a concern and enabling this to happen, I think, is an important aspect on this path to creating a culture of health. Our cafeteria. We've changed the environment in our company, and so many more healthy choices available for our associates for lunch and for breaks, breakfasts, and things like that. We have a Cooking Light series that is available for our associates. Healthy snacks. If you're at a meeting at Ortho Clinical Diagnostics, you won't see those large chocolate chip cookies available for employees as a snack at a long meeting. It's fruit, it's granola, it's yogurt. And as well in our cafeteria, portion control. Part of this is about eating smart and not having those large lunches, but be cognizant and recognize how much you eat at each of these sittings. Our goal really with our cafeteria is sort of eat small portions and eat frequently, and that's really I think the goal to a better diet. And then stories. I believe storytelling is a big part of leadership. It's also a big part of transforming culture. And our employees today are sharing stories with us as a team and with each other. And just several weeks ago, I had a chance to attend our North America sales meeting. And during the course of that meeting, our women's leadership group sponsored a luncheon. And they actually had, as salespeople do, they ran a contest. And the contest was living our vision about being healthier, feeling better, and living longer. And we had 3 individuals individuals share their personal stories about how they've taken control of their own health and well-being, and how they have, changed their diet, have they exercised, how they're, again, a better and more engaged spouse and parent and employee. It's just, honestly, it was humbling. We have a Living Our Vision series on our intranet, and so our associates share these stories via the intranet as part of our culture. Employees around the world are localizing this idea based upon their culture and norms and their locations around the world and what it actually means to them. And the neatest thing about all of this is our employees are inspiring each other. We're sort of kind of creating tribes inside of our culture. And this news and this culture is spreading not because of what I do as the leader of the business or our board, but our employees are inspiring and changing the culture on their own. It's just it's an amazing thing to see take place. Number 5, it takes a team. What I've also learned is that there are passive observers and active participants along the path to health and wellness. But someone must take the lead so others could follow. And I have to be honest with you. When I started this conversation as the leader of the business and began to have a conversation with our employees that I was concerned about their individual health and well-being, beyond what they do for us as an employee of OCD, I think most of them thought I was somewhat of a nut. Like, why is this business leader having a conversation with me about my health and well-being? Isn't he concerned about the business results, the sales results, the income? I would share with them, sort of what my personal health goal was for the year. And at one time I shared with the organization I was focused on trying to get more and better sleep, because I think sleep deprivation is a critical issue, and certainly in this country and around the world. And we always ask for feedback from our town hall meetings, and someone wrote back, "I don't really care that Nick can't sleep. Tell me what's in the pipeline for the next generation products." But if you stay with it and you demonstrate sincerity and authenticity, it resonates. And it's resonating with our people today. And again, what I've recognized is, as a leader, sometimes you think you need to influence the masses, thousands of people. And I think what we found over the last 3 years, it's really about influencing one person at a time. And if you can touch one person and cause them to change, you're starting the movement in your company to change the culture. I want to share with you a story of one of our associates. This is Mike DeLucia. He works in our marketing organization. And he's a person who struggled with his weight for most of his life, as a child. And he was on again, off again diets. And, he just never could get control of his health and his well-being. And at J&J, we're very fortunate to have, an on-site health and wellness team. And he worked with them, and he began to recognize that his cholesterol and his blood pressure was getting out of control. And sort of that was the catalyst that caused him to take ownership for his own health. And changed his diet, began to exercise, took time for himself to sort of have recovery time from work. Mike has lost 35 pounds, and he today competes in triathlons. And the neat thing about it is, besides the dramatic change physically, and if you see a picture of Mike from like 3 or 4 years ago, you wouldn't recognize him. But really what he has said and what he shared with our employees is he's a different person. He's a different person emotionally, physically, and spiritually. He's a better husband, a better dad, and a better employee. It has really kind of changed who he is in the world. And, again, and he's an advocate. And so he's seen this happen for himself, and he shares this, with other associates, with his team, and he's a catalyst to make change happen in our business. Which leads me to number 6, which is it takes a catalyst. People need to find a mechanism to become more empowered about their own health and wellness. I think you would agree with me. People want to do the right thing. And our data and our research indicates that 90% of patients thought they would be more in control of their care if they saw their doctor's notes. And as I mentioned, we created an initiative in our company focused on health literacy of our employees. And we launched this program called Know Your Numbers. Now, you think about it. We're in the diagnostic business, and the majority of our associates, our employees, didn't understand the value of the numbers that come from a diagnostic test. And so we've educated them on that. We also last year conducted a national survey of about 1,000 consumers. And the results of that survey indicated that 35% of the 1,000 consumers we surveyed said they took some action or changed their behavior based on understanding their blood test results. And look, information's available, right? It's pervasive. And there's a basic set of information that we believe people need to monitor, track, and understand to take better care of themselves. Now, I talked about this rapid growth of chronic diseases in this country and around the world. And if you look at the 9 risk factors that predict or prevent the onset of chronic diseases, I believe, right, they're in our control. Now, we can't do much about our age and our genetic makeup, but if you look at the other 7, inactivity, tobacco use, our blood pressure, the diet we have, our glucose levels, our weight, and our blood lipids, we can make changes in our lives to address these risk factors that lead to the onset of chronic diseases. But partners are limited. Just 2% of medical students, right, which is down significantly from 2000, down 12% from 2000, are choosing to become general practitioners. Medicine is changing. As I said, the annual physical just might become a thing of the past. So where are consumers going to get information and support? Our research also indicates that actually consumers at times are more likely to take the advice and counsel of other consumers about their health and well-being than the advice of their doctors. And there are sites that have been created. You may be familiar with a site called Patients Like Me, a site that was created, I guess, back in 1998. And the individual had a family member that had Lou Gehrig's disease, ALS. And he couldn't find, the proper pathway of addressing this disease, and created this intranet site to get others who potentially, had dealt with ALS for advice and information. Well, today there's over 130,000 patients and over 1,000 conditions that are being tracked on Patients Like Me. I think this is a great example of how motivated consumers can be. And we need to go where they are and make it convenient for them to get involved in their own health care. And last but not least, number 7, it's not a goal, it's a journey. No individual will probably ever achieve a perfect state of wellness. The important thing is that we get on the right path and make small changes, because small changes by many are important to you, your team, your community, and the world. And I want to share with you another example of what's taking place in our company. The last blog that I shared with our organization, sometimes this can be overwhelming. Think of all those risk factors and all aspects of my life. And what I've asked our employees to do is to think about just one small thing they can do to get back on a path of wellness. And so this is an actual email I received. Let me read it here. It says, "I thought it would be nice to share with you personally my one small thing. I simply changed some daily habits, using the stairs instead of the elevator, using the bike instead of a car, taking an apple instead of candy, eating smaller portions 5 times a day instead of 2 big meals. And I feel great since. I have more energy, I am happier, more engaged in what I do, and these good vibes transpire in my work life as well as my personal one. What makes this decision so involving for me is that I will be a father, my first kid. And I know that this healthy lifestyle will guarantee a positive environment for him or her." again, when I think about it, it's one person at a time, and this conversation has changed this person's life. And they also add up to big results. You may be wondering, these 7 things I know about people are interesting, but do they have any business results to show for it? Well, first, as I said, I think healthy employees in the business world are a competitive advantage. But as well, at Johnson & Johnson, we have results to show for our engagement and our involvement with regards to our employees' health and well-being. As I said, we've been involved in this for nearly 30 years. And since 2000, the year 2000, we've estimated that we have saved in excess of $250 million in healthcare costs associated with our employees because of this interest and concern and focus we have on employee health and wellness. A lot of times in business, you think about what's my return on investment. And there's a lot of discussion in healthcare about investing in wellness and prevention. What's the payback? When does the payback happen? Well, our data indicates that $1 invested in wellness and prevention returns $3.71. So I think you would agree with me, that's a pretty attractive return on investment for an investment in wellness and prevention. And we have healthier employees as a result of that. You look at these data that are comprised of Johnson & Johnson employees as compared to the CDC US data. Unhealthy eating, we beat every CDC benchmark. Obesity, inactivity, hypertension, high cholesterol, smoking and tobacco use, and glucose levels. But when I think about it, we need to change our mindset. We're still focused on disease. What if we measured wellness or healthiness instead of the incidence of disease? And so these data are just the mirror reflection of the previous chart. So what if we start talking about the percent of employees that have a healthy diet versus those that have unhealthy, and create a positive conversation and a positive environment as it relates to these risk factors? But we have a long way to go, certainly, even though we've made a lot of progress. I believe we have an opportunity to address the crisis in healthcare, an extraordinary opportunity to help people holistically address their healthcare needs. These 7 things I know to be true because I've seen them in action, changing lives one person at a time. We all have a purpose, and we all need to be healthy if we're true to that purpose and want to fulfill it. How many people know this individual? This is Blake McCoskey, who's the CEO of Tom's Shoes. And this company was founded in 2006 after he discovered during his travels to Argentina that children there had no shoes to protect their feet. And the business model for Tom's is for every pair that is sold, he gives a pair away to a child who doesn't have shoes. Obviously this helps to prevent soil-transmitted diseases, and infections that can result as from cuts and sores in their feet. But almost, more importantly, certainly in Argentina, children couldn't attend school if they didn't have shoes. So if you think about it as well, he's enabled the education of children in Argentina as a result of this sort of purpose, socially oriented business model. I think since the founding, he has donated, nearly 600,000 to 700,000 pairs of shoes to children in need. I think Blake is a great example of living your purpose or mission in life for yourself, for your family and friends, for your community and the world at large. In fact, the name Tom's is derived from the word tomorrow. And honestly, that's what inspires me to some small way enable a better tomorrow. So hopefully from this discussion, I've inspired you in some small way, inspired you to think about what you are here to do. It's important. You know, I've met some of you over the course of the day. You're extraordinary, and you can have an amazing impact in the world. It's critically important, but I also believe being healthy matters if you're going to achieve the goals that you set for yourself in your life. So what could we do with that $2 trillion that now goes to treating chronic disease? This is a big question, but there's even a bigger one still. What will you do? Whatever you do, I hope it starts with these 3 thoughts. Be healthier, feel better, and live longer. Thank you for your time today. So I have an invitation that I want to give to all of you today. I want you to join in the movement to enable the world to be healthier, feel better, and live longer. I'm passing out an invitation. And as I said, what I'd like for you to do is to take a moment and really think about what your purpose is in the world, what you're trying to accomplish to make the world a better place. It's personal, it's for you. Also included in the package is a little wristband that has our vision on it to be healthier, feel better, and live longer.
Are you planning to start up a new division in Johnson & Johnson to try to pursue this idea?
Should I stay on the mic? Does that matter?
Yes, please.
So the question was, are we going to start up a new division in Johnson & Johnson to address this? So we actually launched a Johnson & Johnson company focused on wellness and prevention. We launched it it's probably 4 years ago now. It is a B2B, business-to-business venture. It's focused, honestly, on employee health and wellness, so it's employer to employer. It incorporates, as I mentioned earlier, the teachings and the capabilities of the Human Performance Institute, which is a company that we have in Orlando, and as well an internet-based company called Health Media that is essentially an online health coach for individuals, and it's offered as part of a benefits package at times for companies. We had the confidence to launch this business because of the experience that we've had at Johnson & Johnson over the last 30 years. Employee health costs are an important component of running a business, and it potentially could be a large line item in your income statement if you have high health care costs for your employees. And so we think it's an important business, and we're excited about it. And our business at Ortho Clinical Diagnostics, what we're looking to do is to look for technologies that can enable this, I'll say, disruption, decentralization or democratization of diagnostics. I would love to see a day where this technology is available to consumers in their home, and that consumers are fully engaged and activated to be in control of their health and well-being, and through a multitude of technologies have the home be the center of healthcare. And then you can transmit that information via wireless technologies to your healthcare professional, your caregiver, or to whomever is going to be part of your team to ensure that you stay healthy.
One thing that stuck out to me was when you said know your numbers from your physician. What are you doing to enable that? Have you educated physicians? Because they seem reluctant when you ask them for your own information.
Great question. So a couple things what we've done. So with the Know Your Numbers campaign, we started initially with that being part of the health literacy program for our employees, but we have launched it nationally. So the survey that we conducted, along with Know Your Numbers, we actually held a summit last year in Washington, D.C., because policymakers and regulators need to get on board with this if we're going to influence change. We brought in a multitude of stakeholders involved in this conversation, and we partnered with the National Association of Chronic Disease Directors. And what we're looking to do now is to pilot some tests here. And for instance, one of the things that we think is important, if you think about the way the process works today, you go for your annual physical, and in that visit, you get the prescription for the lab work. And then you go to the lab and get the blood drawn, and then the test results come. And again, a lot of times you never hear back from your doctor. Or if you do, there's no real engaged conversation with your doctor about what these numbers mean and how they affect your health and what you can do to change. And so we're looking at a pilot that would enable, as we call it, labs first. So in other words, proactively get your labs done on your way to your annual physical, so that now you have that data, that information, and you can have an informed, engaged conversation with your doctor. And then from that, you can then think about, what do I need to do to address whatever condition or health status that you and your doctor have. The thing about the reluctance, as a matter of fact, I also believe there's I think it was HHS is thinking about ensuring that the lab results are available to consumers. It's our information, right? So we think about the electronic medical record and who owns that data, and this reluctance. Honestly, with all due respect to the MDs that might be in the room, we need to get over it. Because again, an informed, educated conversation with the patient/consumer is what's going to put people back on a path to health and well-being, I think.
So you mentioned taking data home and having it available in these electronic medical records, and there have been a variety of companies over the last 5 years or so that have made an attempt at this. And as far as I can tell, they've all failed one by one. Google Health probably had the best shot with the most amount of money, and they closed January 1st. So why isn't that working?
Yeah, so I can give you my thoughts on it. I think part of the challenge with the electronic medical record is, one of the things that I see is who has responsibility to populate it. And if it's going to be, there's a bit of me that says if it's the responsibility of the individual, the consumer, to populate your EMR, I don't think it'll never take off. And so we need to figure out how existing systems that have this data can populate the EMR sort of effortlessly for the consumer. Now, and we were talking about this earlier today. You go online and you buy things off Amazon. And Amazon, based upon the purchases you make, can sort of populate your files and get smart about the things that you might want to read or watch in terms of movies and books. I would seem to think that we could create some sort of mechanism that takes information that sits out there in insurers and hospitals and employers and sort of self-populate the EMR to make it simpler and easier for individuals to get to this level of sophistication. But we several years ago we looked at the EMR as a business, and first of all, we never thought that was a place where J&J should venture, because that's really not who we are in terms of that capability. But we did sort of ponder the same sort of thoughts about what's going to be the catalyst, what's going to be the mechanism to make this easier. Now, in closed systems and healthcare systems, there are examples of EMRs in places like Kaiser or Geisinger or what have you, where they're the payer, they're the provider of healthcare. But to do that broadly for the population, that's a challenge. We need to figure out how we solve that. I don't have the answer.
Okay, well, I think we're going to have to end here. Before we do, I'd like to continue one of the really nice traditions that we have with the Ford Lecture. We've been doing this since the beginning, and that's to give the Ford Lecturer an original piece of art. Oh, wow. So here you go.
Thank you very much.
This is as a token of our appreciation.
You want to see it?
Yeah, I'm sorry. So this is a token of our appreciation, and hopefully you can remember your day here at Case. This work was created by Erica Weiss. She's a local artist that has a national following, and her work's displayed just up the street in Little Italy. So thank you very much.
Thank you very much. It's been my pleasure.